common questions that we get is what to expect on your first OB appointment. I'm going to tell you that that has evolved quite a bit over the last 25 years of practice. And now what you can pretty much expect is some kind of an intake, evaluation, or phone call from a nurse, nurse practitioner, or physician assistant. During that part, you will be asked a little bit about your menstrual history, your medical history, medications you may be taking, supplementation, daily habits. We will also schedule an appointment to do some initial blood work. The blood work is just to assess immune status to certain significant infectious diseases, as well as a blood count and blood type. Your very first appointment with a physician is typically a very exciting one because we usually do an ultrasound. And that's one of the big innovations over the last 20 years or so, is an ultrasound always done at the first appointment. And we do that for a lot of reasons. We do it primarily to verify that there is a little baby growing in there and that it does have a heartbeat, but also to make sure that there's no tubal pregnancy, to make sure that the pregnancy is viable. Unfortunately, miscarriage rates are pretty high, and so being able to see that things look good at 7 to 9 weeks is really important. We will also usually do a full physical exam, may or may not include a pap test depending on what your history is, and then line out what the rest of the pregnancy will look like, assessing risk, changing medications if needed, and talking about what your plan will look like over the next 9 months. What you might want to do before your appointment is actually prepare any questions you have regarding your pregnancy and the hospital you'll be delivering at, what vitamins do I take, what foods do I eat, when is my next appointment, and how does the group dynamics work? Well, who do I call in case of an emergency? What do I do when? Those are really good questions to kind of outline, and I always tell my patients, don't just count on your memory. The baby is eating your memory from the minute you get pregnant. So please write it down, take notes in your phone. We are always happy to read what you have and then answer the questions, and it's way more efficient for us if you know what you want to ask when you come in.